There's a lot of content online that suggests that if you follow a really good diet, probably like a perfect diet, with very little carbs, and follow exercise routines perfectly, that you can avoid medication forever. Many of these, there are Facebook programs that suggest that you can reverse diabetes. And there are programs that suggest that you don't need medications and you can avoid medications by following that program. The fact is that you probably can follow a program for a year or two, maybe even 3 years, or maybe even more, and not take medications. As long as your A1C is under 7, most endocrinologists will not suggest that you take medications. And even if your medications, even if your A1C goes over 7.0, they will give you a month, 2, or even 3 months to get your type 2 diabetes A1C levels under 7 before they prescribe medications. But eventually, most people will need to take medications. And it's very often the description between type 2 diabetes reversal and type 2 diabetes remission is significant. Reversal implies that you've gotten rid of it permanently. Endocrinologists don't use that term, they use the word remission because they know that most people can get their levels under 7.0 for the time being, but it's unlikely to stay that way forever or for long or for over a year. So I just want to encourage you to make sure that you're using the word remission and that you're trying to maintain control and manage your type 2 diabetes, even if you don't have it at this time because your levels are better. And you're managing it even though your levels are lower. The drugs these days that they have now are much better than the drugs that we used to have. There's GLP-1s like Ozempic, there's SGLT2s like Farxiga, and there's other drugs that are much better than the drugs that we used to have. In the old days, if you took medications for type 2 diabetes, you would end up having the risk of having low blood sugars. Now, if you take Ozempic or you take Farxiga, the SGLT2s, not only are you going to help your blood sugar levels prevent heart disease, keep your blood sugars level and lose weight, but they're also going to help you with heart disease and kidney disease. So I very much want to encourage you to make sure that you follow the medications that are available now. And if you need to take them willingly. It's much more important to take medications and to keep your blood levels below the levels that cause you to lose your ability to control your beta cell production than it is not to take medication. Medication is more important than not taking medication as long as you are producing insulin. And you can produce insulin as long as your beta cell levels are under control. So I want to encourage you to realize that an example that I like to use is Tom Brady versus Oprah. Tom Brady is a football player, or was a football player, extremely disciplined with his diet and his weight and his exercise. Oprah had a little bit more difficulty, and her weight would go up and down. I understand now she's decided to take Ozempic to lose weight, even though she doesn't have type 2 diabetes. The fact of the matter is that Tom Brady can control his diet and his exercise level, whereas Oprah has a little bit more difficulty with that. I tend to think that most of us are more like Oprah than we are Tom Brady. And that's why it's more important to take the medications if we need them, and not to think that we can do without them even when our blood sugars go up. It's better to have our blood sugars normal and take medications than our blood sugars to be high and not take medications. Otherwise, you're running the risk of heart disease, kidney disease, and high blood sugars. Some people like to take supplements, and a lot of programs out there suggest that you take supplements like berberine instead of metformin. Metformin is still the main first medication that many endocrinologists still follow. although some endocrinologists and doctors are now going straight to Ozempic or SGLT2s like Farxiga as opposed to metformin. It's not clear which is going to be the prevailing medicine in the long run. But these days, it's more effective for you to take metformin than it would be for you to take berberine. Why is that? Berberine does lower blood sugar, but people normally take berberine because someone online suggests that you take it, because they don't really want you to take metformin because they don't want you going to an endocrinologist. The worst thing a person with type 2 diabetes can do is not go to an endocrinologist or not follow the prescriptions that they follow. Very few endocrinologists will suggest berberine. The research isn't as disciplined and it's not as controlled, and it's much more controlled with metformin. So I just want to encourage you to make sure that you do that. If any of this makes sense to you, I just want to encourage you to realize that you should follow our program successfully. On the bottom of this program, I encourage you to follow the subscribe button right below, and you'll get our videos virtually every day, or most days when we give you a subscribe position on email. Also, I think that you should follow our program. We have a free guide called the Type 2 Pivot Method Free Guide, which will allow you to review our program, the Type 2 Pivot Method, and encourage you to follow that also. So if any of this makes sense to you, get our free guide or subscribe to our program and subscribe to our program. Thank you and have a great day.